Auzubillahiminash-shaytanir-rajeem. Bismillahir-Rahmanir-Rahim. Welcome to my lecture number 17. So in this lecture we will discuss about the nursing intervention and anti-migraine therapy. So in previous lecture we have already discussed the different drugs which are used in the treatment of migraine. So this lecture is totally related with nursing care, how you can handle the patient and what is the treatment protocol which is given to the patient. Now come toward the nursing care for anti-migraine patients. So first of all, you will have to take much cares about the patients. Initially, by taking a careful history is the most important aspect of diagnosing migraines. Let's suppose whenever you are going to diagnose a migraines, so first of all you will have to point out that the patient is suffering from which kind of migraines. So at that time you should take a careful history, which is the most important aspect and diagnostic tool for migraines. Secondly, the patient should be asked about the pattern and frequency of attacks. So it is also very important, you should ask the patients about the patterns and the frequency of attack. While this should be include the durations, age at the onset, whether there is a family history of migraine or not. So these are very important. You should ask the questions from the patients that especially which include the durations, depend upon on the type of migraines, the age, and especially at the onset and whether there is a family history of migraine. Then we will determine the severity and the type of fan, whether it is a dullage, throbbings or stabbing fan, the location of the pains, and whether it is worse or moving around. So it is also very important, you should ask these frequently asking question from the patient, and it can be easily for you to investigate the past and present history. For some patients, administration of soluble aspirin or paracetamol in the early stages of an attack will work very well. The addition of the antiemetic to reverse the gastric stresses and aid analgesic absorption as well as helping those with nausea and vomiting should be considered. As I have told you, especially in my previous lectures, that whenever you are going to administer a treatment protocol to the patient, so first of all you should know about the condition of the patient, that either the patient is in mild state, moderate state or severe state, so then you can treat the patient according to its conditions. And the problem is that you will have to you can say to maintain the dose which is required for the patient who have infections. The fifth one is you will have to diagnosis and evaluation of headache required a detailed headache history, focus the physical examination and neurological examinations that should be done. As well as it is also the responsibility of the nurse that he or she should notice the headache history, should include the characteristics of the headache, for example in our precipitating factors, relieving factors, intensity, quality, durations and frequency. After that, it is another responsibility of nurse that headache history also should include the age, when the headache begins, any change in the headache history and family history of the headache and migraines. History is of the chief importance because many patients may not know the difference between migraine and headache. So first of all you will have to identify that the condition is headache or migraine. तो आप स्पेशली नर्स ने ये एसेस करना है कि फॉर एग्ज़ाम्पल अगर कोई पेशेंट है उसको माइग्रेन है या हेडेक है तो उसको एटियोलॉजिकल क्लासिफिकेशन के बेस पे क्लिनिकल यू कैन से क्लिनिकल एटियोलॉजी जिसको हम कहते हैं कि इसके कॉजेज़ क्या है, वजूहात क्या है एंड व्हाट आर द एग्रीवेटिंग फैक्टर्स। तो ये सारे चीज़ें जो है इट शुड बी नोटिस, इट शुड बी नोट डाउन, सो विच इज़ द special responsibility of the nurse who is working in the healthcare system. In general, migraine prophylactic medication should be started slowly and then titrated slowly to maximize the therapy while avoiding the side effects. As I have already discussed in my previous lecture about the side effect and adverse effects, तो वो ऑलरेडी मैंने डिस्कस किया है कि किस तरह, क्योंकि साइड इफ़ेक्ट जो है ड्रग की जो अपने इफ़ेक्ट्स होते हैं एडीआर में बहुत एहतियात करनी चाहिए, क्योंकि एडीआर एडवर्स ड्रग रिएक्शन में अक्सर ओवर डोजिंग होता है और ओवर डोजिंग की वजह से फिर एडवर्स ड्रग रिएक्शन सो दे आर रिपोर्टेड। सो उस केस में फिर आपने बहुत यू शुड टेक ए प्रिकॉशनरी मेजरमेंट्स। तो जनरली माइग्रेन जो है प्रोफाइलेक्टिक मेडिकेशंस का मतलब ये है कि ट्रीटमेंट बिफोर द एंट्री ऑफ अटैक इट शुड बी स्टार्टेड स्लोली, आहिस्ता आहिस्ता आपने उसको स्टार्ट करना है एंड देन टाइट्रेटेड स्लोली टू मैक्सिमाइज द थेरेपी व्हाइल अवॉइडिंग द साइड इफेक्ट्स। And you must will have to avoid the side effects. The desired dose may need to maintain a minimum of 8 to 12 weeks before the maximal effect is achieved. So, what is the desired? You must know about the maintenance dose, the desired dose, which is needed for the patient to maintain the minimum time period of 8 to 12 weeks before the maximum effect is achieved. Why we are going to treat a disease in order to achieve the therapeutic effect? Therapeutic effect को achieve करने के लिए हम treatment करते हैं। When initiating prophylactic therapy, the patient should be understand the finding the right drug at the right dose with the least amount of side effects might be slow process. So this is clear that whenever you are going to initiate the prophylactic therapy to the patient, so it should be understand that finding the right drug at the right dose. अगर आपका drug जो है वो ठीक है, आपका डोज जो है वो ठीक है, तो इसका मतलब ये है कि स्पेशली जो साइड इफ़ेक्ट्स है ठीक है उसके रेट्स जो है वो कम होंगे। इसके अलावा जो एडीआर है एडवर्स ड्रग रिएक्शन है ठीक है इट विल बी रिड्यूस। सो डेफिनेटली सो इट मीन दैट फॉर राइट ड्रग राइट डोज एट द राइट टाइम राइट पेशेंट, दैट इज कॉल्ड रैशनल ट्रीटमेंट और यू कैन से रैशनल थेरेपी। सो रैशनैलिटी इज इम्पॉर्टेंट as well as another responsibility of the nurse. This is not only the responsibility of the nurse but ये सारे हेल्थ केयर सिस्टम में फिजिशियंस हैं, उसमें फार्मासिस्ट का रोल है, नर्स का रोल है, पैरामेडिक्स का रोल है। तो ईच एंड एवरीवन हैव देयर ओन रोल्स एंड दे विल प्ले इट। अब जो है फॉर एग्जांपल्स फार्मासिस्ट का काम क्या है ठीक है, तो फार्मासिस्ट का काम यह है कि वो डिस्पेंसिंग करता है, उनका काम भी डोज एडजस्टमेंट के साथ हुआ कि किस तरह आपने फॉर एग्जांपल हाउ यू कैन कैलकुलेट द डोज फॉर जीरियाटिक्स फॉर चिल्ड्रंस एंड मेनी मोर्स। There may be a potential period of 3 to 6 weeks before any appreciable change is noted and a minimum of 8 to 12 weeks before maximum desired effect is achieved. As I have already discussed that if you want to achieve the desired therapeutic effect, so you must will have to maintain the steady state concentrations and the time periods and especially the dose adjustment. This is very important. Patient should be advised that many burdensome but harmless side effect of medications will likely subside after a few weeks of treatment and the medication shouldn't be discontinued without consulting the primary care physicians. ये कभी कभार इस तरह होता है कि हमें पता है कि कुछ ड्रग्स जो है उनके जो साइड्स इफ़ेक्ट्स है उसको हमने स्टडी करना है कि अगर साइड इफ़ेक्ट माइनर है तो फिर खैर इसको अवॉइड करना चाहिए ठीक है। अगर मेजर है तो मेजर में फिर जो है यू शुड कंसल्ट विद फार्मासिस्ट। सो फार्मासिस्ट यू नो इज ही इज़ अ पर्सन who is legally and professionally qualified on drug. He is drug expert as well as he holds the degree of Form D. तो इसमें एहतियात करना चाहिए कि फॉर एग्ज़ाम्पल अगर साइड इफ़ेक्ट माइनर्स है तो ऐसा नहीं है कि डायरेक्टली आप जो है स्पेशली आप ट्रीटमेंट को उसको आप डिसकंटिन्यू कर लें, ठीक है, विदाउट कंसल्टिंग द प्राइमरी केयर फिजिशियंस. सो तो इतना कोई इशू नहीं है. पेशेंट शुड बी एडवाइस दैट मैनी ब्रदर्स दैट हार्मलेस, कुछ साइड इफ़ेक्ट जो है वो मतलब हार्मलेस होते, इतना नुकसान नहीं होता. अच्छा, another thing, first line treatment should be based on not only a minimal side effect profile but on any you can say comorbid conditions that may be helped or exacerbated by the choice. So first line treatment should be based on not only minimal side effect, we are going to minimize the side effect of the drug, but on comorbidities. Two terms are used. One is morbidity and the second one is mortality. Mortality means that how much people their dies. Morbidity का मतलब ये है कि कितने लोग जो है मतलब वो इस इन्फेक्शन की वजह से, इस डिजीज़ की वजह से उसको ये इन्फेक्शन हो गए हैं. अच्छा, so it depends upon on your choice. For instance, a beta blocker would be contraindicated in a patient with a migraine, especially वो patient जिनको migraine है. So beta blockers, so they are contraindicated especially with a migraine and asthma. जिसको migraine है और इसके साथ साथ asthmatic patient भी है तो बीटा ब्लॉकर को फिर अवॉइड करना चाहिए. दिस इज contraindicated, it cannot be used. But a tricyclic antidepressant might be a good choice. TC, you can say tricyclic antidepressant like fluoxetine, duloxetine. So this is a good choice for the patient with migraine, asthma and depressions, or other for the patient with migraines, asthma and neuropathic pains, prophylactic treatment for the prevention of migraines. Another core responsibility of the nurse is in a prime position to offer advice to the patient with migraine who may not wish to bother the doctors. Actually, nurses, the primary roles of the nurses you can educate the patient about the diet, about the lifestyle of the patient, about the importance of having regular meals and adequate intake of waters. Less caffeine should be used, and you can say a regular sleep pattern. So all these parameters should be checked. Three things which is very important in your life. So this is the quote of today. Three things in life that is very important. The first one is your health. The second one is your missions, your objectives, and the people you love.